The shocking truth about nighttime habits that are slowly killing your kidneys. If you're over 60, please listen closely. This isn't clickbait. Your kidneys work quietly around the clock, filtering waste, balancing fluids, and helping regulate blood pressure. Most people assume kidney damage only comes from dramatic events or long-term disease, but there's a quieter, far more common threat. Small nighttime habits that pile up night after night, adding pressure and micro-damage to the kidneys. Tonight, I'll take you through 6 bedtime mistakes seniors make every single night. Things that sound harmless, but over months and years can push your kidneys towards serious trouble. I'll explain the why, the science in plain language, and crucially, what to change immediately. This video is about practical protection, not panic. Stick with me and you'll walk away with a simple nightly plan that protects your kidneys and helps you sleep better. Mistake number 1, the snack that feels harmless, but damages your kidneys overnight. That late-night snack may soothe you, but salty, sugary, or processed foods have real consequences for kidney workload. When you eat salt and refined sugars close to bedtime, your blood pressure can spike and your body holds on to sodium and water. The kidneys must then clear that excess, a job that becomes harder with age because kidney filtration naturally declines. Repeated daily stress from diet causes tiny injuries in the renal tissue. Over time, those micro-injuries add up. Instead, swap the chips or candy for kidney-gentle options. A small apple, a few unsalted nuts, plain yogurt, or a banana half if you need something sweet. Better yet, aim to finish anything substantial at least 2 hours before bed, so your body has time to normalize. These small swaps reduce blood pressure fluctuations and daily kidney strain. Mistake 2. What happens when you ignore the bathroom before sleep? You know that feeling. I can just hold it until morning. That's tempting, but regularly going to bed with a full bladder raises bladder pressure and can transmit pressure backward toward the kidneys, especially in people with bladder weakness or prostate enlargement. Over time, that backward pressure can cause hydronephrosis, a stretching and impairment of the urinary tract which forces kidneys to work harder and increases injury risk. The fix is immediate and simple. Make a habit of emptying your bladder as the last step before getting into bed. If frequent nighttime urination is a problem, adjust daytime fluid timing, avoid large drinks within 2 hours of sleep, and discuss bladder training or medication timing with your clinician. Preventing unnecessary bladder pressure is one of the easiest and most effective ways to protect kidney health tonight. Mistake number 3, this sleep position could be silently crushing your kidneys. It sounds improbable, but how you sleep can affect internal circulation. Sleeping tightly curled on one side for long stretches, or using pillows that bunch under your midsection can intermittently compress the renal area and reduce local blood flow. Kidneys need consistent blood supply to filter properly. Repeated night-long compressions, particularly in seniors with vascular disease, can create small zones of hypoxia, places where oxygen delivery dips. And those zones over time can lead to scarring. The practical solution: aim for neutral spinal alignment. Use supportive pillows that stabilize your neck and hips instead of piling them under your torso. If you sleep on your side, put a pillow between your knees to keep hips aligned and avoid twisting your torso. Encourage slight postural variation through the night by keeping your bed comfortable and balanced. Simple sleep setup tweaks reduce the chance of repeated compression. Mistake number 4, one missed pill, one wrong step, and your kidneys pay the price. Medication. Adherence is a quiet, life-saving habit for kidneys. Many seniors take drugs that directly protect renal function. Blood pressure medicines like ACE inhibitors or ARBs. Diabetes drugs that reduce kidney stress, statins, and more. Missing doses leads to uncontrolled blood pressure and blood sugar variability, which are two of the most destructive forces for kidneys. Conversely, frequently taking NSAIDs, ibuprofen, naproxen, or combining them with certain supplements can reduce kidney blood flow and cause acute injury, especially in older adults. The practical routine: use a pill organizer, set phone reminders, keep a printed medication list by your bed, and schedule an annual medication review with your doctor or pharmacist. Ask specifically about kidney-friendly alternatives and interactions. Do not stop prescribed medications on your own, but always clarify whether any over-the-counter or herbal products could hurt your kidneys. Mistake number 5. Cold feet at night. The kidney danger. No one talks about cold feet aren't just uncomfortable. They reflect peripheral vasoconstriction, the narrowing of blood vessels to preserve core heat. When peripheral vessels constrict, overall circulation changes, and in people with vascular disease or diminished cardiac output, nighttime kidney perfusion can suffer. Reduced blood flow overnight means kidneys clear less metabolic waste and may slowly accumulate micro-damage. Warm feet are an easy, low-risk fix. Wear breathable socks to bed, use a warm water bottle at the foot of the bed, or use safe, low-heat bedding. If you have persistent cold extremities, check with your clinician for underlying causes like thyroid issues, peripheral arterial disease, or poor circulation. Treating the root cause improves circulation, and circulation at night helps kidneys recover and detoxify while you sleep. Mistake number 6. Yes, water can hurt you if you drink it at the wrong time. Hydration is vital, but timing is everything. Drinking large volumes of water immediately before bed floods the system and forces kidneys to work overtime while you're trying to sleep, causing disturbed sleep and repeated awakenings. On the flip side, being chronically underhydrated concentrates urine and increases risk of kidney stone formation and higher concentrations of metabolic waste, which stresses nephrons. The balance is steady hydration through the day. Sip water regularly and reduce intake 60 to 90 minutes before bedtime to minimize disruptive nocturia. If you're on diuretics, have heart failure, or have specific fluid restrictions, follow your doctor's timing advice closely. Often taking diuretics earlier in the day reduces nighttime stress. Small bedside sips for comfort upon waking are fine, but avoid bedtime water binges. Consistent daytime hydration and smart nighttime timing keep kidneys working smoothly. You should seek medical advice if you notice persistent changes, swelling in your ankles or face, unexplained fatigue, decreased urine output, foamy urine, a sign of protein, darker than usual urine, blood in the urine, or sudden weight gain that suggests fluid retention. If you have diabetes, high blood pressure, a history of heart disease, or previous kidney issues, be proactive. Ask for an annual kidney function test, serum creatinine and EGFR, and a urine test for protein. These blood and urine checks are simple but powerful. They tell you whether your daily habits are helping or harming your kidneys. Early detection gives you options. Late detection forces limited choices. Kidney protection is not a single heroic act. It's daily care. These nightly habits may seem minor in isolation, but they accumulate. Imagine saving a little kidney function year after year. Those small choices compound into preserving independence, avoiding medication escalations, and reducing the chance of dialysis later on. Follow the checklist, discuss concerns with your clinician, and make gradual, sustainable changes. For many seniors, these adjustments are the difference between quiet resilience and slow decline. Your kidneys are quiet, but not invincible. The small choices you make each night, what you eat, how you sleep, how you manage stress and meds, determine how well those organs can keep you healthy as you age. Make the easy changes tonight. Skip that late, salty snack, empty your bladder, warm your feet, set up your bed for comfort and circulation, and take your medicines like clockwork. If you suspect sleep apnea or have chronic anxiety, bring it up with your clinician. Treatment can change your kidney trajectory. If this video helped you, please hit like, subscribe, and share it with someone you love. Kidney damage is silent. Awareness is your first line of defense. And remember, these tips are general guidance. If you already have kidney disease, heart failure, or diabetes, discuss any new routine with your physician. Take care, sleep safely, and protect those kidneys, one night at a time.